Hi, I am Renato Ambrosio from Rio de Janeiro, Brazil. I'm very happy and grateful for participating in the Cross-Linking Users Meeting 2021. I thank Dr. Hafezi for the nice invitation and also Medifacus for the opportunity to present in this very nice session. So my topic is a very promising device for riboflavin delivery in epi-on cross-linking. My special thanks for my colleagues Nelson Senna and João Figueiredo, both from the Federal University of Rio de Janeiro. And my financial disclosures are listed here, including, of course, Medifacus, who is the proprietary for the new device that I'm going to discuss. Of course, keratoconus has been known for many years. When you talk about the huge evolution that we had with the advent of refractive surgery, I do believe refractive surgery is a new specialty that we have in ophthalmology, and therapeutic refractive surgery for keratoconus is a major part of the work that we do as refractive surgeons. It's important to understand the role of refractive surgery for diagnosis, clinical and surgical treatment, and eventually as an enemy, because eventually keratoconus is aggravated by laser visual correction with or even caused by severe impact from the procedure. It's important that we go for the understanding from diagnosis, patient education and clinical treatment and surgery. Surgery is indicated to halt ectasia progression and for visual rehabilitation. And today, of course, we have the opportunity to improve patients' life with refractive surgery, but keratoconus surgery should not be a primary refractive procedure, but eventually, if we can deliver refractive results, we should be keen when it's safe to offer that to the patients. In our consensus, visual rehabilitation is done with glasses or contact lenses. Important that contact lens gives us best vision, but should not be considered as an alternative to halt ectasia progression. They even can accelerate based on if the case is not well fit to the contact lens, and it does not slow down. That's a very important message. But eventually, I'm going to give you some hints on a new application of scleral lens for eventually improving the results of epi-on cross-linking. We know that clinical treatment for keratoconus is related to allergy control and telling people not to rub the eye. This is very important that we tell people not to rub the eye. I think, and I tell every patient that riboflavin diet, rich diet with supplements like B2 supplements with omega-3 could be very beneficial for those patients. And I tell this is more art than science, but it makes a change. Eventually, we know the great work by Damian Gatinel that supports the eye rubbing as a sine qua non for keratoconus. I believe eye rubbing is a major force for keratoconus progression and even can cause ectasia, but eventually, as in our consensus, the importance is unquestionable, but I think keratoconus is a multifactorial disease that is related to other factors, including a natural predisposition or susceptibility for ectasia, so that some cases that are very predisposed for keratoconus progression, that are weak corneas, they may progress even with minimal or no eye rubbing. Our work, the Violet June campaign, has a major impact on the message for not rubbing the eye, but eventually understanding that the misinformation caused the patient to suffer more than the disease. So explaining about what are the options and eventually considering that eye rubbing aggravates and cause the disease, we stopping that, we can make a huge impact to prevent visual loss for keratoconus. We are definitely in recognition for Professor Seiler and his team back in Dresden, Wollensack, Sproul, and others, and the very nice evolution of the understanding, even taking the collagen out of the front of the book. Corneal cross-linking involves extracellular matrix, and how to get the cross-linking done with and when to indicate it is very important. I think this is one of the situations that we should prevent visual loss for keratoconus, but we should consider the risk that epi-off cross-linking may offer. This is a patient that was presented as a JCRS case report in the consultation section. Patient had a scar. I was able to look in detail with the pentacam image. Patient had severe blur and astigmatism, that loss of this vision, and a lot of anisometropia because the fellow eye was very much normal. And looking at the fellow eye, you see that this patient does not have keratoconus in the right eye. So I do believe keratoconus is a bilateral disease. Even though there was an ectasia in the left eye, the loss of vision made the point that we don't have cross-linking. But even though I think cross-linking is a Nobel Award deserving achievement, but we should be really keen to consider that prevention is better than the cure, but eventually prevent a complication that is related to the eventual prevention should be a must. So it's important that we indicate cross-linking properly. And our idea is to get a safer procedure. So the quest for epi-on cross-linking came, and a lot of people have discussed that epi-on is the future for cross-linking. We know from the great work done by Hafezi and his colleagues that oxygen is a must, along with UVA light and riboflavin, for the cross-linking reaction to occur. So we need to think about how to put riboflavin into the cornea, how to optimize the fluence of UVA, and eventually understand the photochemistry so that we get a good combination of the result. And epi-on cross-link is more challenging because the epithelium will block riboflavin and also will block the UVA. So we need to improve, and the quest for cross-linking epi-on enhancing safety with an efficient, there has been very well studied by Cosimo Mazzotta and his 4 level of comparison. So the cornea saturation with a solution with a higher concentration of riboflavin, eventually using enhancers like the cross-linking USA protocol and others, enhance the fluence from 5.4 to 7.2 or even 10 joules. We have also oxygen diffusion to be improved with post-light and also with some goggles to enhance oxygen delivery with the oxygen supplementation. Interestingly, there is a report for a standard epi-off cross-linking done by colleagues from Brazil, and they use the riboflavin delivery with the standard scleral lens, but with an epi-off procedure, and they had very nice results. And I think it may accelerate a little bit the riboflavin time, but our idea is to have a protocol for epi-on cross-linking, and we have the D3 epi-on protocol that is sponsored by Medifacos. So the riboflavin would serve as a reservoir for the riboflavin solution, the scleral lens, and then we have more contact of the riboflavin during this soaking time, and that may overcome the need to remove the epithelium. So it is a perspective on our open, controlled, non-randomized study that was approved by the ethical committee at the university here at the Federal University of Rio de Janeiro in Rio. We got approval for 30 patients, and we have done the first 5 cases, 3 of them with 6 weeks follow-up. The inclusion criteria is older than 12 years old and minimal thickness higher than 300 microns, because we can adjust based on the fast cross-linking protocol. But I think this should be one of the things that we can really adjust. We also should consider, based on the knowledge that we are learning in this meeting, that we can enhance the fluence of cross-linking, eventually optimizing. But we have at the university the IROC2, which is fixed at 9 milliwatts light. So the lens is a scleral lens that was modified to be serving as a not a refractive lens, just a scleral lens. And we have the anatomy of the lens, the geometry of the lens optimized for fitting advanced cones. We have 3 models, small, medium, and large, considering the scleral diameter. And that's important that we try to optimize eventually using some imaging techniques like the pentacam with the profilometry and other imaging devices that can give you scleral data. So immediately before the D3 contact lens is placed, this is the slit with a blue, cobalt blue light, and with a standard white light. We put the riboflavin and soaking up to the top, and eventually use some devices, or even with the hand, you can easily place that on the patient with a topical anesthesia. This is the scleral lens with the riboflavin, and you look at that at the slit lamp, and the patient sits for, now we are looking at 1 hour, and they can be very comfortable at the waiting room for 1 hour with a lens soaked with riboflavin. After 1 hour, we see removing the riboflavin, the very nice penetration. This is very promising in my opinion, and we use also the OCT so that we can try to find some changes at the B scan of the OCT for demonstrating riboflavin soak, which is somehow challenging, but probably this is something that we don't need to do in every case. So this is one of the cases, 1.5 hours, and we realize that we can go down to 1 hour. We use the FAST protocol with the ROC2, as I mentioned, and you see this little fluorescence of the UV light. So it means that there is riboflavin. Of course, this is after a few drops to wash the riboflavin solution from the epithelium to remove it from the tear film. And so just the riboflavin that was embedded on the cornea is kept during this treatment. So we have the first 5 cases. All cases had no pain after surgery. The CVA was exactly the same as pre-op in the first day after surgery in all cases. And the promising results, as we can see, one of the cases is a little over a month after surgery. You see some flattening, and eventually people may be skeptical and say the patient did not rub the eye, and that's only related to this. But I think I may have some data to present in the future, looking at OCTs for the demarcation line and also biomechanical analysis with the Corvus for demonstrating cross-linking effect. So when you think about the Epion scleral D3 as a riboflavin delivery system, the promising results for Epion, I think Epion should be considered as the goal, the holy grail for efficient cross-linking, as we have seen many years of research on that, and we are finally getting different options for cross-linking Epion procedures. The improvements beyond the D3 scleral lens as the riboflavin delivery system are related to enhancing the B2 solution, eventually with some penetration enhancer. Of course, looking at higher fluence and UV optimization, even looking at the customized cross-linking, oxygen boost can be also related to that. I think refractive surgery is a new specialty, and keratoconus ectasia is a new subspecialty within refractive surgery, as the concept of therapeutic refractive surgery and eventually getting Epion cross-linking would definitely expand the number of cases that we perform surgery today, because Epi-off, at least in my hands, I have to consider the pros and cons, and eventually the patient still has good distance correct vision, typically better than 20/25. I tend not to do the procedure unless there is a huge indication for that based on the multimodal imaging on follow-up, or even about mechanical susceptibility for ectasia to progress. But I think Epion would definitely change the whys and the whens on the indication of cross-linking. Of course, this is not a refractive elective procedure, and we have to educate patients because they may confuse refractive surgery and therapeutic surgery. Multimodal imaging for individualized medicine, patient education is always going to be important, and we should always consider the medical corpus Hippocraticum, which is related to heal a few times, believe often, and always comfort the patients and the family. Is one of the most important messages and goals for our Violet June campaign. So thank you very much for your kind attention. And once again, congratulations for the great meeting in keratoconus corneal cross-linking that we had in 2021. Thank you.